Welcome to the first episode of the InnerSpartan Unleashed podcast. We are in the midst of a global pandemic, so I've asked my friend, physician, and entrepreneur, Dr. Raj Singh, to join us today to talk to us about what it's like to be both a physician and an entrepreneur during these troubling times. He's got some great insight he shares in this show, so let's get on with the episode.
Welcome to InnerSpartan Unleashed.
This is a gut check.
The weekly podcast from your host, the CEO of InnerSpartan, René Rodriguez.
This is the opportunity you've waited your whole life for, the chance to become the hero of your own story.
Each week, you will receive expert tips from leaders in business, health, fitness, and relationships. Our mission is to get you unstuck and living your best life. Get ready to Spartan up.
Dr. Raj Singh is an internist and nephrologist who specializes in health, wellness, hormone balancing, medical weight loss, and anti-aging therapies. He has trained numerous physicians, allied health professionals, pharmacists, and others over the past decade in the art and science of overall wellness and comprehensive health management, instead of the traditional symptom and drug-based approach. He practices at Healer Primary Care and 7 Heart Spa in Las Vegas, Nevada. He is an assistant professor of medicine at the UNLV School of Medicine and faculty at Empire Medical Training. Dr. Singh has received several top doctor awards, has appeared on television and radio shows, and is considered an expert in wellness and anti-aging circles. He often travels to teach at medical conferences throughout the United States and abroad. He's also one of my physicians. Dr. Singh, welcome. Thanks for being here.
Thank you for having me here.
So we're several weeks into this current COVID-19 crisis, and there's a lot of information out there already in the public sphere. Some of it's credible, some of it's dubious. How are you advising your patients and loved ones on how to best care for their physical and emotional well-being during this crisis?
Well, sure. So these are, challenging times to say the least. And yes, a lot of misinformation is around. It is human nature to have some sense of control. And right now, most of us feel like we are not in control. And that's why you see a lot of panic buying and people are extremely stressed out. We do know that maintaining a good routine is very important for emotional and physical well-being. We have to maintain some sense of normalcy, or at least we have to try to maintain some sense of normalcy. So I do recommend that to all my patients that they should still sleep at the same time, get up at the same time, shower, dress up, maybe go for a walk, maintain the same distance, and spend less time watching the news or spending time on social media. Because right now, a lot of time is being spent on social media. And there are multiple studies we know where if we spend more than 30 minutes on social media, it's associated with increasing rates of depression and also loneliness. And if you have somebody who already has depression and they cut back on their social media consumption, generally depression symptoms do get better. And also a lot of this news ends up stressing us, raises our cortisol level, which of course suppresses our immune system. And right now, it's not a good time to have a suppressed immune system.
You brought up 2 points that really resonated with me. One was about routines, and the other was about the mental health implications. As far as the routines are concerned, are you saying that those are important from the perspective of managing your stress, or don't these routines also help you in terms of either hampering or helping or improving your immune system?
Yeah, as I said, our biological clock, we all have a biological clock. So we ideally should sleep at the same time, wake up at the same time. So when our routines are disrupted, we know that, if I'm working all days and now suddenly I have to work on some nights, my immune system is going to be suppressed. So that's why normalcy is so important. Right now, the more we can try to maintain a normal schedule, I love going out for a walk. Should do the same, maintain the 6 feet distance. But getting up in the morning and sleeping at the same time, although you don't have to go to work in the morning, is still very important.
There was a lot of talk initially about the virus primarily attacking those like me who are immunosuppressed or have a history of other health issues like high blood pressure, which might make you more susceptible to a negative outcome should you get sick. We're also seeing a lot of people who are younger. It's not just attacking those who have immune system problems, is it? Or were there possibly underlying problems in some of these cases that we're hearing about that we're just not aware of?
Well, it's a virus, so it really doesn't discriminate against the young, old, healthy, or the sick. It's just how the infection is going to be. So generally, if you have underlying history of high blood pressure, diabetes, or you have a suppressed immune system, these patients tend to do poorly. They are more likely to end up on the ventilator. But in the younger individuals, what we are seeing is that more damage is being done by the immune system while it's trying to contain the virus. So it's causing a lot of inflammation, especially in the lungs, as it's trying to get rid of the virus. And a lot of disease and damage is actually from the young person's own immune system. So that's why they're getting so sick, because the immune system, let's put it, is overreacting to the virus.
Is there a genetic corollary to this?
Not to my knowledge, and like I said, we're learning so much about this new virus. But to my knowledge, I am not aware of any such correlation.
As a physician, what are some of the common myths you've been hearing regarding COVID-19 that you'd like to dispel?
Well, first important one is like, okay, if I wear a mask, I'm protected. So generally the regular masks do not protect against the virus. It's just too small of a particle. The mask is good to prevent others from getting sick from you. So if I have the infection, yet I don't have any symptoms, people around me will be protected from me if I am wearing a mask, because when I cough or I sneeze, I'm not spreading those droplets into the air. So that's the first myth, that just wearing a mask is not the answer. Okay. And then of course the other is that it's just a flu, it's just going to go away. It's definitely not a flu, because the mortality rates with COVID-19 are close to 5%, versus seasonal flu is only 0.1%.
Is that the current mortality rate, or is that projected?
That is the current mortality, about 4 to 5%, which is very, very high compared to just a seasonal flu. And then, of course, the other myths, okay, I'm young, I'm healthy, so I don't have to worry about this virus. We saw all those spring breakers, so that's not a good thing.
Yeah.
And also, the virus is a biological weapon, created by China to destroy everybody, but all the available evidence simply says that it's a natural animal origin. It's not a constructed virus.
You work in a hospital setting as well as
Correct.
your private practice. What's that like these days? I mean, are people just totally freaked out when they get there? Now, I'm not just talking about the staff. And by the way, thank you for everything that you do every day. And I think for the first time, in terms of the national consciousness, there's a greater appreciation for those in the healthcare profession, even for those folks who are serving food in restaurants and working in the food distribution supply chain, who are putting themselves at risk so that society can go on and try to stay safe. So thank you for that. Getting back to the hospital environment, what's that like these days?
Everyone is definitely stressed out. Our patients, doctors, nurses, all the staff, because one, we don't have a lot of information. Every day new information is becoming available. Two, a lot of us do feel unprotected because there's not enough supplies. So the stuff that usually we used to throw away, now you have to carry it all with you all day. So definitely the stress level for everyone is quite high. A lot of healthcare providers I know are quite overwhelmed. They're tired, they're exhausted. Plus they're worried that, what if they get their family members sick?
As a physician, how do you enforce quarantine while respecting a patient's right to autonomy and privacy?
So to quarantine someone is not an easy decision, first of all, right? And when we do quarantine, it does curtail someone's civil liberties quite a bit. Mm-hmm. But we also have, as a society or as clinicians, we have the ability to kind of prevent harm to others if we can, right? And quarantine is a very valuable tool, and it can help prevent spread of communicable diseases. So it should be utilized when we need it to. But again, we have to also make sure that we're using the least restrictive measures required. And also as a society, we have to make sure that that person who is quarantined, when he's off the quarantine, that we treat him with respect. Because right now there's a lot of discrimination that happens when patients or people are quarantined. And I do believe that it's okay to give up some of our rights for a short term if it serves a greater good. It does serve humanity at a bigger level.
If they're quarantining in a hospital, can you kind of paint a picture for me? I remember when my father was dying of congestive heart failure, he got C. diff and was quarantined. I remember how impersonal and difficult that was to experience, seeing my loved one in that kind of environment. What's it like for people who are primarily alert but just very sick? What's that experience like?
So I think what you're describing is what we call isolation, which is a little different than actual quarantine. So isolation is when we have a contagious disease, like could be C. diff. If you go in, you have to wear the protective gown and a shield. Yeah, it's very impersonal. But when it's quarantine, it's way more strict. That means generally no visitors you're not allowed contact with. And the number of medical providers you can see is also very, very limited. So a quarantine means that you will not be allowed to, go to a grocery store. So right now we're doing, self-quarantine, but in a lot of other countries, they are under kind of strict quarantine, and some have to wear ankle bracelets, so make sure that they are following those quarantines. So that's what you were describing is more isolation. Quarantine is just way more strict.
Oh, I see.
If it's enforced, yes.
With the projected numbers that we keep hearing about, there's a lot of talk about the healthcare system becoming overwhelmed and crashing. But what can we do as a society to mitigate that kind of disaster for the hospitals?
So, our healthcare system is very fragmented. First of all, it is already overwhelmed. It's already crashed. What as a society we can do is, of course, stop panic buying stuff, and especially the things that we don't really need. We have a shortage of masks, gloves that should not be bought by anybody other than healthcare providers or hospitals. And of course, this is not the time to be mean to human beings around us. I've seen a lot of hate speech, a lot of discrimination against Chinese Americans. As a society, this is the time to be nice to people and help who we can. A lot of people have lost their jobs. Help them with their food. Any help. That's what we need to do. We need to help each other out right now.
I can understand the natural predilection to be concerned about reaching out to your neighbors because everyone wants to protect themselves. But Yendy and I, we have some elderly neighbors, and we went over there to make sure that they had our phone number in case they needed anything. We said to them, if you need something, call us. We'll go get it for you. And even then, standing at their front door, there was a certain amount of concern where, what if I'm carrying this virus and I'm unaware of it and I get this gentleman sick and he takes it in and gets his wife sick? So it's hard, but nonetheless, I think that we have to take prudent measures, but still be there for others as best we can.
Absolutely. It's those small things we do for each other that make the most difference.
Yeah.
Absolutely.
And if you could have dinner tonight with anyone, living or dead, to discuss the global health and economic challenges that we face today, who would you break bread with and what would you ask?
So I've always been fascinated by, Sir Warren Buffett, CEO of Berkshire Hathaway. He's 85 some years old now. And, he was born during the Great Depression. And he's been through his so many recessions. Yeah. And his company is still here and is still doing very well. So he's a person I want to sit with and see how he managed his anxieties and how he got through his company through all those recessions and what is his secret. I'm
a big fan of his as well as his business partner, Charlie Munger. I don't know if you've read Charlie's Almanac. I'll loan it to you. It's a great book. Mr. Munger talks a lot about cognitive biases, and a lot of people in my space have become very familiar with the cognitive biases because it helps us in working with others and helping them see breakthroughs in their lives. And, I'm glad that you brought up Warren Buffett because I want to start talking about you as an entrepreneur. You have your own business. But before we move off the topic of COVID-19 and the current pandemic, what questions should have I asked you about this that I just didn't know enough to ask?
Maybe, how I'm dealing personally.
Yeah, that's a good point. Yeah, how are you dealing personally with this?
Well, I'm definitely stressed, not so much for my own health, but I have 2 young boys. I worry that, when I get home, they're always trying to, run to me and hug me, and I'm trying to say, okay, give me time to clean up.
Yeah. And how old are they?
So I have a 3-year-old and a 6-year-old.
Oh, yeah.
I'm worried about, what if they get sick because of me, and then how I'm going to deal as a parent, and what if something happens to them because of the infection, how I'm going to live with something. So that's what bothers me every single day. So that's definitely a scary thing about the virus, yes.
All right, so let's move on to the topic of entrepreneurship and managing through this crisis that we're all dealing with now. How do you manage the inherent stress that comes with being a business owner? You talked about it from a physician standpoint, but how do you manage it as a business owner and staying healthy?
Well, I generally always do things that make me happy. I avoid negative people like the plague.
Yeah, it's good practice.
And I take care of my health because if I have a good health and my mind is clear, then I'm able to take better business decisions. And because we only realize the value of health when we actually are sick.
What about your team? How are you helping lead them through this, manage their anxieties in this climate, and ensuring that the business needs are still being met?
Yeah, sure. We're in the healthcare industry, so naturally they were all very concerned whether they should be working, all about the exposure. So I made sure that they all had all the protective equipment they needed to take care of our patients, because our patients also need us at this time, and we have to take care of them. So I made sure that they had the gowns, the shields, everything they needed to take care of our patients. And when people are secure, they generally are happy and they are more productive. So once they felt that they had all the equipment they needed to take care of our patients, generally the anxieties kind of went away. a lot of the anxieties as healthcare providers we have right now is because we feel unprotected. We feel exposed because we don't have the equipment we need, and we are around some very, very sick people. So when you see nurses wearing their own masks, that it should not be acceptable in a country like ours.
Now, you've also reduced the traffic in your offices now because you're doing some telehealth.
Correct. So we do a lot of telemedicine. We ask our patients to wait in their car, so their exposure is minimized. So we've done a lot of those things, and our business is functioning at a reduced but still an optimal rate.
And is that the future, you think? Is that going to just be part of the normal course of business for you?
I'm generally a very social and very personable physician, so I love seeing my patients. I love giving hugs. So telemedicine, yes, it's probably definitely the future, but it still feels so distant to me. And if the patients are just with me, just shaking their hands or holding their hand, is just a better feeling to me than worse than seeing somebody from the screen. But I guess we all have to kind of get used to the technology.
Can you share some of the steps that you've taken to mitigate the economic risks to your business and to your team?
Yeah, so I always have been very honest with our team. We are a new business, so they understand the struggle. I learned that when I'm honest with them, the team does better. So they all offer to, get rid of the cleaning company. They said, we'll clean the office ourselves. And of course, we reached out to our landlord and some utility, and we were able to negotiate some better prices. Mm-hmm. We reduced non-essential. So yes, we have cut back. Our staff, they agreed to have some reduction in payroll. We also had a medical spa, so we unfortunately had to close that because of the current governor's order. It's been tough, definitely.
Do you have any systems or mental frameworks for decision-making, learning, and execution during times of crisis like this?
So I'm generally a risk taker, and I'm a very positive and optimistic guy. So I know things will be okay, and I do my best to make sure that I don't look stressed when I'm around my team, because I'm the leader. So if I'm stressed, then they will also get that from me. I make sure that they see that I'm working hard to make sure that they have a paycheck. And again, like we said, we try to remove all the non-essential things and try to minimize our overheads. But generally, I'm not a huge business plan kind of guy. Yeah. I like to learn. I like to make mistakes. I like to make decisions, learn from them, and readjust my strategy. That's what has worked for me so far. And I'm very quick to make decisions.
How often are you guys getting together as a team to communicate or give them the forum to communicate to you what they're concerned about?
Yeah, so we generally do about once a week is all we're doing, because again, we want to kind of limit exposures in our conference room. So we're meeting about once a week and getting thought from everybody, reaching out to patients and trying to bring more revenue to the practice by using telemedicine, helping our older patients who don't have smartphones or who don't know how to use the technology. So our staff is spending a lot of time training these patients how to use their smartphones or computers.
Oh, great.
Yeah.
This is probably a two-part question. It applies to everyone, but especially to entrepreneurs and leaders who work under demanding conditions. The first is, how often should we have our blood counts analyzed? And the second part of that question for me is, in my experience, I've had doctors in the past who have looked at my normal results on a blood count test and were satisfied even if the results were on the low end. And as you know, because you work with me directly, I've been focused on trying to optimize my levels and trying to get my numbers to the higher end of that normal spectrum. Should everyone do that? And if so, is there a point of diminishing returns? Should someone be looking not just to be in the normal range, but try to optimize it for themselves?
Okay, so the first question was, how should we have the blood counts analyzed? I think if you're otherwise asymptomatic and healthy, just a yearly checkup is more than adequate. Teen blood count chemistry can provide us a lot of information. If you have, of course, symptoms, then of course more frequent testing is required. So, but once a year is all you need, the basic stuff.
Yeah. But even if you're not sick, you recommend that someone, as part of their annual checkup, get their blood count, see where they're at, see what they could work on for the next year.
Absolutely, because there are so many silent diseases. I'm a nephrologist, so we deal with kidney disease. A lot of time I see patients who actually are about to start dialysis because their kidney stopped working and they have no symptoms. And some of them, they don't even believe me. I tell them your kidneys are working at 10%. And I'll say, I feel fine. So blood tests are very, very important. Certain diseases do not show up as symptoms till the very, very late stage. Diabetes, high blood pressure, effect on kidneys. So a yearly blood test at a minimum should always be done, even if you're feeling healthy.
And I don't mind talking a little bit about my situation. I've had, as you know, and many of my followers know, I've had cancer. 3 years ago, I had exogenous Cushing's. And had an issue with my hormone levels. Got much better after doing some hormone replacement therapy, after doing some stem cell therapy. But over the course of the last, I don't know, probably since the fall of last year, I was starting to put on weight. And, at first I thought, well, maybe I just ate one too many croissants in Paris. But when we got back, it started to escalate at a fairly rapid rate. I started to get very tired. I was, lethargic and kind of just really struggling with my energy, which is unlike me. I typically am pretty full of energy throughout the day, even though I come off as pretty even keeled for the most part. But I was really struggling and recognized that there was probably something wrong. I came in to see you and we did some blood tests and we recognized that my testosterone was very low. So we did some therapy about that, which I'm more than happy if you wanted to share about the pellets, because I hadn't heard about that until you told me about them. And I am feeling much better today. It's been, I don't know, about 2 or 3 weeks now. Yeah, about 3 weeks since we've done that treatment, and I'm feeling a lot better, and it's going to last about 6 months, but you could talk about that a little bit, because I don't know, some people may not know that this sort of treatment's available to them who might be experiencing the same thing.
Sure.
They don't want to go the synthetic route like I did before, which caused other problems for me, which is why I got off of that. Can you talk a little bit about that?
Sure. So the first thing is normal results, right? Physicians were typically trained to look at reference ranges. So if something falls in the normal, we'll say, hey, I don't know why you're having symptoms. Your test results are normal. You are fine. And a lot of patients are dismissed that way. Now, those reference ranges are more from very healthy individuals, so they may not apply to anything. So I always tell people that I train that, don't look at the blood tests. They can be in a reference range. If your patient is having symptoms, you got to believe them and start investigating what's going on. Again, the results can be normal, but it can be a body's way of compensating. So, for example, if someone is really, really stressed out, yes, they will be able to mask a good response. The cortisol levels can be within the normal range, but it's going to come at the cost of, let's say, suppression of testosterone levels, because our body has finite resources. So if something is more importantly needed, it's going to divert all the resources to do that work. And then the results can still be kept in normal, but you don't feel normal. You feel like you're exhausted, you're tired, your body has no energy. Or towards the end of the day, you basically have no motivation to do anything.
Yeah.
And the results can always be normal. So symptoms are more important. Reference range blood test is not very important as far as I'm concerned. And while we're talking about the synthetic hormones, we always have to make sure that we are not overdoing on any replacement our body needs. Because if we overdo on the testosterone, our body stops making testosterone. We overdo on the thyroid, our own glands stop working. So we have to make sure that we support the health or support these glands versus giving an end product or end result or end hormone, because that generally causes a lot more problems. I do like bioidentical testosterone. I do like inserting pellets. They can last up to 6 months. Your body's getting a little dose of testosterone you need every single day. And I have seen really good results with pellets. I train a lot of physicians on inserting pellets, and I think it's a good testosterone therapy, much better than injections and, of course, the topical creams.
Yeah, great. Well, so far, thumbs up for me. So we'll see how it goes. We'll check in next month.
Glad to hear.
Yeah. What's the most important thing you've learned about being an entrepreneur, and how has it shaped your personal and professional life?
So what I learned most importantly was to basically trusting the team that's around me. Before that, I used to do everything on my own. So when I started the business, from bookkeeping to accounting to designing my own website, creating the social media, and everything that came with the business, I was doing myself. And of course, I was doing a mediocre job at best. It was just hard to give the control away.
Yeah.
So that was very hard for me to do. But once I learned to do that and I got the right people, I saw that my business did really well. So I think that was one important thing as an entrepreneur. We had to learn that, yes, it's our company, it's our baby, but we have to trust other people to take care of our business, because I can't be there all the time. People are now always complimenting me that my staff or my team is really awesome at taking care of our patients. And they're always asking me, how do you find these people? Where do you find these people? So I think they just found me, and I just have given them the trust that they deserve, and they take better care of my business than I could have ever done.
You mentioned Warren Buffett earlier.
Yeah.
He likes to say that hire smart people and then just get out of their way.
You need to have good people working for you. And entrepreneurs are good at solving problems.
What are some of the common myths about your profession as a physician, or about entrepreneurship in general, that you'd like to debunk here today?
Well, I think one definite thing is that we are human. We have our own insecurities, and people generally look at doctors and say they are probably the healthiest people around, but I can say from my personal example, we're not. So we deal with a lot of stress, and a lot of addictions are very, very common. doctors are just human beings, and we are also weak, and we also have our health issues.
What assumptions did you make about running a business before you started that you know are not true today?
Well, I definitely assume that I'm a very smart guy because everyone tells me that you're a great doctor. So I thought I'll be a great businessman. I was so wrong. I made so many mistakes, lost so much money, and I had to correct my mistakes. But when we're intellectual, we generally get a little bit of ego that we are good. And I think that's something that really hurt my business initially. So once I had to let go of my ego and says, I don't know about everything, and I had to learn from the people who've been doing it for a long time, I think that was a starting point for our business to improve. So I was the biggest problem my business had.
I'm always kind of humored by when they're talking about a business leader or entrepreneur or a CEO, whatever, and they might say something like, well, that person's a little bit of an egomaniac or a narcissist. And I was like, yeah, that's the point. You have to be a little bit in order to run a business. You have to be a little bit of that in order to create something from nothing, to have the courage and the confidence in order to do that. As entrepreneurs, we have to keep that in check. There certainly are malignant narcissists out there, and that's not a good thing. But you can't be a wallflower and decide to strike it out on your own and then inspire others to do that as well, and to take that journey with you unless you have the confidence to do that. People want to know that you're going to be in that battle with them and that you're going to lead them to victory.
It was definitely a humbling experience to start a business.
What's the most interesting thing about you that we wouldn't learn from reading into your bio?
Well, generally when people think of doctors, they say this is a boring guy, nerdy guy. But, I am a big adventure freak, and I like to skydive, scuba dive, swim with sharks if I can.
Really? We should talk about that offline a little bit. So it's been a topic between Andy and I quite a bit.
Like I say, so when we think about doctors, it's probably a boring guy. I went to school 15 years, and I'm a very adventurous guy, and I seek adventure at all costs.
It's been terrific having you here today. I've enjoyed the conversation. Where can my followers connect with you online?
Thank you for the opportunity to be here. They can reach to me on my Facebook page, which is Raj Singh MD, or connect me through my YouTube channel or Instagram. Or if they can simply call our office if they want to see me as a patient. Our office number is 702-362-2273, or visit us online at www.healor.com.
I'll put links to all of those things in the show notes here. Again, Dr. Singh, thank you for joining us.
Thank you.
I can't wrap up this episode without a very special thanks to you, the listener, for following me on this podcast journey and being part of the InnerSpartan tribe. Please subscribe to this channel wherever you consume podcasts, rate it, leave a comment, and if you have a friend or family member who could benefit from this kind of content, please share this with them. I'll see you on the next episode of InnerSpartan Unleashed.